We are celebrating Mother's Day this weekend, so to highlight our moms and the amazing things they do, we want to help take some stress off their back. Legacy Physical Therapy is St. Louis's premier provider of pelvic physical therapy. Here to share some more tips for moms and how to protect their back, we have Dr. Brooke Kalisiak. Dr. Brooke, thank you so much for coming back today.
You're very welcome. I'm glad to be here.
Okay, so we have 3 simple tips for the mamas, and I'm excited to go through
got
those.
our model here.
We have our baby.
We have our baby doll. So our first one is that hip pop out to the side. So most moms kind of jut out to the side and rest the baby on it.
Yes.
So that can put a lot of strain on the back.
Okay.
So thinking about, it's okay to do it for a little bit, but you got to switch sides.
Okay.
Okay, and ideally kind of keeping your hips in the middle is going to be the best for your back.
But if you did want to pop out your hip,
you got to go a little bit on both
just
sides.
need to do
Spend
both
time.
sides.
We tend to have a side, and we do it always on the one side, and that's going to be a lot of strain on the back.
Okay, wonderful. And then the next one was about posture, which I really liked.
Correct. So a lot of moms, especially if we're holding up here, tend to do a lot of lean and back.
Yes.
Okay, and that's going to put a lot of strain through the back as well.
Yeah.
So I tell moms to think about like you're being pulled up tall with a string,
Okay.
and a little bit of pull in at the belly. Not gripping, but just a little bit.
So as if there's just one string.
Pulling you up tall.
And pulling you up tall.
So that we're in a straight line versus more of that lean and back.
Okay. Well, and it is hard. I mean, I've held a lot of my nieces and nephews. They were all big babies, which we love the big babies, but it is, you get tired. Okay, so this third and final tip is a really important one as well.
This is more for lifting, so especially when we're doing that kind of lifting up and down from out of the crib or off the floor, try and get as close as possible.
Okay.
And bend from the knees and the hips to do
Bend from the knees and hips. Don't just reach down.
Yeah, most of us tend to do this whole bend over, and that we want to bend our legs too and come up from the legs as well, so we protect our back.
Okay, wonderful. And we have just about 30 seconds, but I know you mentioned 50% of women will have this lower back pain.
Yes, this is such a common issue we see in our practice with moms with low back pain because they have that weakness in the abdominal muscles from it getting stretched out during pregnancy, and we got to rehab that and get it working better.
Of course, and the babies is up and down and up and down. So show your mama some love. Mom, show yourself some love. All that information right there on your screen. Have a great weekend.